And tonight we have a report on healthcare in Ireland. Now, Ireland ranked 15th in a European survey of quality of healthcare. The life expectancy in Ireland is almost 80 years, almost 2 years longer than in this country. One of the problems facing Ireland is shrinking tax revenues, and that's making it difficult for Ireland to pay for its healthcare reform plan. 5 years ago, flush with prosperity, Ireland started to reform its healthcare system. It began centralizing healthcare and offering higher salaries to doctors to switch to the public system of healthcare and give up their private patients. Richard Saltman of Emory University has studied many European healthcare systems.
Essentially what they did was increase the pay for hospital physicians, increase it quite a good deal. But in return, those hospital physicians had to restrict or eliminate seeing private patients in the hospitals and having them in private beds.
Every citizen is covered under the public health plan, but 50% of the population buys supplemental private insurance to avoid the long wait times on elective surgery.
In the public sector, one can wait up to 3 years for a hip replacement or a corneal lens transplant.
Patients in need of immediate care often flood emergency rooms, says Bruce Pollack, who has studied healthcare in Ireland.
In hospitals, waiting times in emergency room for urgent or emergent care in Ireland is longer perhaps than I've seen it in any other developed nation.
There is one doctor for every 333 people, compared to one for every 416 in the United States. Ireland spends 7.5% of its GDP on health care, compared to 16% in the United States, and $3,424 per person, compared to $7,290 in the United States. Life expectancy, 79.7 years, compared to 78 in the United States. Costs are starting to strain the system as tax revenues decline in the current economic downturn. One thing Ireland has done well is foster the development of the pharmaceutical industry.
The government was providing significant tax benefits to entice the pharmaceutical industry to invest in the manufacture of chemicals in Ireland. It actually helped fuel the economic engine of the Celtic Tiger. And so there is a very congenial relationship between the ministry and the industry.
Now, there has been some relief in demand for services in the last few years. Many of the legal immigrants that flooded Ireland in the boom times have now returned to their home countries after the recession wiped out their jobs. So that has taken some of the pressure off of the healthcare system.